August already, but it is. And so let's go to the Lord in prayer. All right. Heavenly Father, thank you so much for today. Phone on. There we go. All right, guys. Welcome. You are tuned into 1100 WSGI, and this is Lee Marie with the Go Show. I'm so glad that you all have joined us today. Let's go to the Lord in prayer. Heavenly Father, thank you so much for today. Thank you for waking us up. Thank you for giving each and every one of us a purpose. We ask that you take this show exactly where you want it to go. We love you. We praise you in the mighty name of Jesus. Amen. All right, guys, we do have Wild Doc coming in, and so super excited because, I always say send in those, difficult health questions because he's got so many wonderful pieces of information. And before he gets in here, though, I do want to tell you about some exciting things going on today because today is the first Friday of the month, which means first Friday market if it doesn't rain. So I'm saying that because the first two Fridays of for Friday markets, they both rained. And so we're looking forward to tonight. And I will be outside well in the square. And it's at 600 South Main Street, right next to Crossroads Christian Bookstore. And now I'm also inside Crossroads Christian Bookstore as well. And we have, not only do we have health, physical and mental wellness classes, we also now have some other things being taught like sewing and crafts. And these are taught by some wonderful Christian ladies. We had an absolute blast last Monday with Carla's sewing class. So she's going to be starting a 101 sewing class this coming Monday. It's only $20 if you sign up by Saturday. Otherwise, it's $30. But I hope you guys will go to the Well in the Square Facebook page. Take a look at our August classes and our August events. One of the events that we're having in August is a sock hop. Everybody's been asking for one. So we're going to do one on Friday, August 22nd at 6:30 p.m. So I hope that you guys will take a look at that. And you can always, message me on Facebook if you have any questions at all. All right, guys, we have Wild Doc here, and it's been a minute, hasn't it?
A little bit, yeah.
Let me get your mic.
But
There we go. All right. So, how have you been?
been good.
Yeah, how's the
Doing well.
family?
Yep, and baby's great.
Good, good.
Family's well.
And the new digs, everybody's finding it all right?
Yeah. Oh yeah.
Awesome. It's so nice to be there. It feels like a, retreat just being there.
Yeah, we've got a young buck deer's coming down to eat pears falling off the pear tree right now.
Nice.
Some of the kids that come into the clinic and get treatment
Oh.
care are so excited to see that deer when he's out there in the kind of the front yard there when people drive up. So
Very cool.
he's kind of our neighborhood deer. He beds down on the hillside there when you drive down the drive. So
Nice.
don't hit my deer if you want. Come driving down. So,
Be careful. Yeah. Well, in general, you
Put one
gotta
of them
just.
signs out that says "Kids in play" and "Deer in play."
Yeah, really. You need a little deer crossing
There
sign.
you go.
Yeah, there's been more than ever so many deers it seems, and I hit my first one. Well, my first one hit me, I should say, because it clearly like came off a hill, flying. Like I would have no chance of
Yep.
doing anything. It just came off a hill, and so but thankfully my car was not totaled. It had minor damage, over $1,000 damage, but it could have been way worse. The stories that I hear from people. So guys, be careful out there with all the deer. Okay, Wild Doc, I am going to put the camera on you for a moment so you can tell people a little bit about where you are and what you do, and I'm going to go take care of some
Yeah.
production situations.
So what's up, everybody out there listening? I'm Dr. Dale Brown, also referred to as the Wild Doc. I love the wilderness, love being outdoors, love the creations the Lord has provided for us, and that's one of my philosophies in healthcare and medicine is that when we're relying upon the herbs and the nutrition and the lifestyle factors and modifications that we can utilize, really, you think about it, we are relying on God's creation to allow us to heal and recover. And in my clinic, what we do is I provide primary care. I have hired a nurse practitioner to do so. She provides wellness-based and holistic-based, naturally based primary care for our community. So we got a lot of little babies, a lot of new moms coming in and keeping their children healthy. Over the last year plus since we started to provide that service in the clinic, we have only needed to prescribe literally less than a handful of medications. And so compare that to the average primary care physician out there when they're seeing hundreds of patients. You can imagine that they're getting a lot of pharmaceuticals. So our goal is to keep our children healthy through direction, guidance, and assistance to these patients to allow their children to not need to potentially suffer the side effects and risks of pharmaceuticals. So we do all we can to keep them off of antibiotics. We educate and inform and help our patients understand the value and benefit of things such as a fever and how protective and beneficial that process is that God designed the body to have. Also, just helping with what I believe is what primary care should be for, and that is the guidance through things like lifestyle. How do you create a healthy home? How do you reduce toxin exposures? How do you reduce the need for medications? How do you understand the body's natural way of fighting and combating infections? What is healthy? When to introduce foods, things like that. What foods to introduce first? These are things that our nurse practitioner helps parents understand and walk through. And then I provide chiropractic care. Now I provide structural corrective chiropractic care as well as neurologically based chiropractic care. So we treat people for a wide variety of conditions, from obviously the simple things such as back and neck pain, but also all the way up in assisting the body in communication between the brain and the body and helping people, their body, combat things such as cancer. Now, that may sound crazy to y'all, but I actually mention it because it gives me the opportunity to kind of give you a little bit of explanation behind why it is so essential to have a healthy spine and nervous system if your body is combating such things as cancer. They've actually taken animals and animal studies and done what they call a sympathectomy. They removed the sympathetic nervous system, nerve roots, transmitting signals from the brain to that region of the animal's body, and they can implant cancer cells into that animal's body, and the cancer would grow. If they did not remove nerve supply, they could not allow the cancer would not continue to grow. The body's communication system would alert the immune system. So the way I describe this is your immune system is like your armed forces. It's your military. Those are your soldiers, those white blood cells. And the nervous system has to sense and identify that there's a problem going on. And then it recruits your immune system to that region and allows that area of the body to combat and fight off the cancer. Now, obviously, these were taken and utilizing healthy animals at the time. And what I'll say is that chiropractic alone obviously is not a standalone treatment, but when you understand, meaning it's not a standalone treatment, it's not the only thing you should do, it's not the only thing that I would do if myself or any one of my family members were to be stricken with cancer. I would take a multifaceted approach, and that's really what we do in the clinic. And so I'll also speak to the reality on this little short topic is that if you take animal studies, they literally have to separate the nervous system, or they breed their animals with no immune system. So those are your two primary components, your nervous system, a healthy nervous system, and a healthy immune system that allows our body to combat cancer. Now, in this day and age, if we can reduce the toxic overload that we're being, bathed in practically in this world right now with pesticides and chemicals and things like that. And of course, as I'm speaking to this, I am praying that our politicians do not do the ridiculous thing that is being proposed, is give chemical, herbicide, and pesticide manufacturers immunity against future lawsuits for their chemicals causing cancer, because Bayer is begging and pleading, please stop the Monsanto Roundup lawsuits of lymphoma. Please don't file any more lawsuits. Please, government, give us immunity. We know we've caused people to die early and suffer horrible, horrible effects of these chemicals, but just don't make us pay money to the people that we've destroyed their lives. It's just ridiculous. Politicians do not do that, because that will show us as American people that you do not care about the people. You care about industry and profits. So sorry for getting off on a little bit of a tangent there, but sometimes we have to, because that's what we face this day and age. We face a profit-driven public health disaster. I'm actually quoting from a movie that is called Escape Fire, and it talks about the broken healthcare system in America. How broken it is that it's profit-driven and it's a public disaster, because we have the worst outcomes in every single industrialized nation, the worst health outcomes in everything from newborns, pregnant women, all the way up to our grandparents, great-grandparents, in terms of lives saved in the initial phases of life, and actually in life years lost, meaning how many years did you have the potential to live, but sadly you've lost many of those years because of the healthcare system. And so our system, our healthcare system that we have developed and are continuing to evolve in our clinic. And our clinic, again, myself and our nurse practitioner providing primary care, medical care, can prescribe medications when needed. We are there to, if you come in and you're on a medication, we are going to do all we can to help your body function and heal appropriately, so that then you don't need that medication anymore. And then if you are there and you want to stay well, that's what we're providing. That's a type of care that ultimately I would want, if I wasn't a healthcare provider, I would want to take my children to a place that works to keep them healthy, not just stands idly by and says, hey, when they have something going on, we'll go ahead and start prescribing medications that have no, natural biological benefit for your system. You give a pharmaceutical drug to a healthy person. What do you end up doing? You cause dysfunction, you cause disease, you cause toxicity, you cause liver damage, you cause neurological mitochondrial dysfunction and damage. And I'm mentioning one thing that actually occurs just by taking Tylenol is tens of thousands of people wind up with liver damage and mitochondrial dysfunction and toxicity due to Tylenol, standard Tylenol use. So we just help our patients understand the way the body works, how it heals, how it functions, and ultimately how you stay healthy, or how you give your body, your children, yourself the best opportunity to stay healthy. And then, so providing chiropractic care, providing primary care, we provide functional medicine. And I had a client here recently. I thought that term was so well known, and just when you're in different sphere of influence, I guess. Somebody asked me, what's functional medicine? I say, well, it's the focus on restoration of the function, the natural, normal, healthy function of your body. And when your body is functioning properly, that is the definition of health. And in fact, most people, when you ask them, what is the definition? If you want to achieve something, let's say you want to be healthy, a lot of times in my classes and courses that I teach to our patients, I would be like, all right, so who here wants to be healthy? Pretty much everybody would raise their hand. And then I say, okay, so what is health? Define it for me. Most people will say, it's how I feel, if I feel good, things like that. And I'm like, well, how does cancer feel? It doesn't feel like anything until it's literally pressing on a nerve or causing enough pain. And at that point in time, you're in full-blown disease process. What's a heart attack feel like? Or cardiovascular disease is a better question. What does cardiovascular disease feel like? The development of what will lead to the heart attack. Everybody like, oh, chest pain and things like that. Okay, you're having a heart attack. So you are literally 20 plus years into the development of that disease process. So you don't feel anything until it's literally, sadly, death knocking at your door many a times. And so what I tell people is, if you understand the definition of health, it is the complete function, not merely the absence of disease and infirmity. It's the full function of your body, not the absence of disease or symptom infirmity. And so understanding that functional medicine, chiropractic care, is focused on the restoration of function for those people who have already been in a dysfunctional state, meaning their body has developed disease process, they're dealing with chronic issues and problems. Well, we're restoring function so that then those problems go away. And then maintaining appropriate function of the body is then a primary goal in our clinic as well. And then we also provide such services as hyperbaric oxygen therapy, infrared and photobiomodulation, molecular hydrogen therapy, things like that, as well as functional neurology care. So we just completed our first intensive with a child dealing with pretty severe ADHD. And in fact, when he originally came in to see me, he was on 3 medications for ADHD and was diagnosed with both autism and extreme ADHD. And he's off all of those medications. Here's a crazy and amazing thing that the mom actually told me. And so people just, if you don't realize what mothers and parents go through with a child with severe autism or severe ADHD, do not judge here in this moment when I reveal to you what this mother said, because this is an answered prayer for these parents. But she said, Dale, you don't understand. Like, it's actually, like, it's fun to be his mother now. And what we're seeing, sadly, I had a discussion with some parents here recently about this too. And they were talking about like the idea of this neurodivergent, theory and model that like autism's always been here. It's just we're diagnosing it better. And then I played this video of this university, professor, and she's like, I'm autistic. I have these issues. I'm actually a high functioning autism. I'm on the neurodivergent. And she's talking, she's going through these things. And I'm like, yeah. But then, so if you classify yourself as autism, I had a mother there and she's like listening to this. She's like, there's nothing more infuriating than watching people who can completely function in society just fine. Yeah, on the backside, they may have some anxiety about, social situations, but they can function. She's like, my child, we can't even go to church. We can't even go out in public because he beats his head. He, flails around. He has outbursts. Like, we can't do any of that because anything outside of the normal routine of his day and even just slight changes throws him into a combative fit. Like, oh, my boy's 13 years old, doesn't talk at all, has no verbal communication capability at all. And he's autistic, and now she's saying she's autistic. That's ridiculous. And what they're trying to do is they're trying to water it down in society and say this is normal. It's just we should accept we should accept and love them as human beings, but we shouldn't accept the fact and just say, hey, go ahead and live your life, there without the ability to communicate, without the ability to express love and affection and things like that, without the ability to tolerate sensory stimuli of your environment and thus break down in a panic, anxiety attack, and then lash out in physical force and violence, or not be able to understand that you can't go walk off into the wilderness by yourself because you have no innate understanding of fear and awareness of your surroundings. And that's why so many of these kids, sadly are disappearing from their children, and then search parties can't find them until they find them drowned in a lake or river and things. And so it's like this idea that these kids don't need help. Anyways, again, another tangent. I apologize, but to have this mother say that, this boy is off all of those medications. Another really cool thing that this mother said to me this last week during intensive therapy, she said, Dale, when I thought about it, a year ago, I had my boy on 3 medications that if I were to be found to have those on me and not have a prescription, I would go to jail. And she's like, and I was giving those things to my kid. Just thinking that's what you do. But we've worked through gastrointestinal, gut-brain connection. We have worked through his spine and nervous system. We've done those things. We've gone through changes in nutrition. We've gone through detoxification phases. We've done a lot to cover all of the various known mechanisms that drive dysfunction in the brain. And then now that what I call it is his body is no longer in this state of defense, inflammation. If you're fighting a battle in the defense mode, when you talk about like your immune system, and this is one of the things that many people aren't aware of, they think that autism and things like that is just this psychological condition. It's a brain only condition. But it's not a brain only condition, because when you look at it, the vast majority of these kids, oftentimes studies will find more than 50% of children with autism and ADHD will actually have autoantibodies. They'll have an autoimmune disease occurring in their brain causing inflammation. When you have inflammation, your body's in what I call defense mode. It's not in development mode. So when you get them out of that defense mode, you help remove potential toxins or inflammatory triggers or poor diet and nutrition that drives inflammation. You heal and seal the gut when you do that. You can improve the barrier function of the gastrointestinal system, which has a direct influence on the barrier system of the blood-brain barrier to keep things out of the brain that shouldn't be there. And once you do that, now the brain is in a state where it can heal. So another analogy I will give people is, when the house is on fire, it's not time to bring the lumber and try and rebuild it. You've got to put that fire out first. And then ideally you identify what started the fire and you correct and remove that, so that then when you try to rebuild, even if you're suppressing the fire with water, yeah, you may bring it down to a smolder, but if you don't get rid of those coals, it could go up in flames again once you build the house. So the idea here is to put the fire out, identify, remove the cause or causes, and that's the reality, is it's never a singular solitary cause of these children suffering with autism. And then from there, then now you work on what is called neuroplasticity, and you start driving sensory feedback through their nervous system into their cerebellum, which then fires up to the higher cortices, and you can identify through a series of physical exams. We can do a physical exam and identify regions of the brain that are not firing and wiring correctly. We can actually determine if we have a weak cerebellum on one side versus the other, so that people kind of understand a little bit of neurology here. Our cerebellum is our brain stem, and that little brain, if you look at a brain model, it's kind of like a smaller version of our big brain, which is our cerebral cortices. It's right here at the back of the skull, at the top of the neck. That's where your cerebellum is. And that receives all sensory information from everything from your fingertips, from your toes, to your hearing, to your sight, and even your gastrointestinal system, to your heart rate, everything that sends information up. And the vast majority of communication actually is sensory input to the cerebellum. It processes that. It has thousands of times more neurons in the cerebellum than we do in our cerebral cortices, in our cerebral cortex. And so understanding that, you can kind of conceptualize how valuable and important the cerebellum is. And the cerebellum must develop first, and then the cerebellum is what fires into, let's say in ADHD and autism, areas of the brain that they see that are immature or not functioning correctly. That's the frontal lobes, the frontal cortex, the motor cortex, the areas of the brain like Broca's area that controls speech. And so when we take and we stimulate, I'll back up here for a moment. One of the ways they describe this in neurology, the issue at hand when you see a child already developing these symptoms and problems that then lead to the diagnosis of ADHD and autism, we're seeing that the brain has not matured or the brain has been injured and damaged. And so At infantile stages, if everything is healthy, going right, we don't have any physical injuries, any toxic injuries, any immunological injuries, we don't have anything that disrupts normal development, then passive stimuli, that is passive stimulus through, hey, let's say a father playing and wrestling with their kids, throwing them up in the air like every father does, and see that joyous look on their kid's face, through hearing mom and dad talk to each other, through just normal things, normal sensory stimuli will naturally cause stimulus to the cerebellum, and the cerebellum takes that electrical stimuli and then fires up to the frontal lobes. And that natural passive stimuli is more than sufficient for healthy neurological development and development of the frontal lobes and then maturity of the frontal lobes. When the brain is injured or it does not develop appropriately, something halts or resists natural normal development, we have to use intentional stimuli. And more than just simple passive stimuli. You have to almost not overstimulate it, but you have to use a significant amount more stimulus to drive enough of signaling up into the frontal lobes to allow it to then develop and come back online. And so when you use enough stimuli, you can get into the effects of neuroplasticity. The brain needs a strong stimulus. And so through these intensives, what we're now integrating into the practice for this subset of the population is to actually do 1 or 2 hour intensive sessions every day for roughly 2 weeks for most at a time. And what that does, the way I describe it, is if you want the brain to change, if you want to develop and strengthen a neural pathway, take, for instance, shooting free throws, all right? You have to practice to improve to make a free throw like Michael Jordan did. Now, if I told the parent, okay, what we're going to do is we're going to do these sensory exercises, all right? And we're going to use these sensory stimuli. And I want you to do it. Let's do it for 1 minute, once a day for 1,000 days. Or if I said, let's do 1,000 in 1 day or 1,000 in 1 week. So go back to the free throws. If somebody shot 1 free throw per day for 1,000 days versus 1,000 free throws in 1 or 2 weeks, which person is going to be better at shooting free throws after that 1,000 repetitions?
Right, the consistent one.
The one that did it in 2 weeks. Mm-hmm. Because you have to have enough intensity and frequency to actually drive that increase in that pathway development, that neural pathway development. So that is where those intensives are literally changing the game. So I went to an office in Iowa to study these intensive programs for children with autism and developmental delays. One of the mothers there with a boy that was no longer classified as autistic because she came to the clinic for 1 week. Mind you, she had already done these generic online programs, things that are like, okay, you're going to integrate these reflexes and things like that and do these sensory exercises with your children for 10 to 15 minutes a day, maybe 3 days a week, 4 days. She's like, I went through that and we were 9 months in. She's like, I had gone to others and got things that I could do at home and I tried, but nothing was really moving the needle with my son. Nothing was improving his situation. He was still, he had words, he could say words, but he could not put them into any logical conversation, communication. So the uniqueness of this story that I love is the fact that the father that I love, and wait till the end of the story here, not the father's situation, but the father was like, we have spent tens of thousands of dollars for various different things. We were hopeful. We've spent tens of thousands of dollars on, medical care just for our son with autism. He was like, at his end of his rope. He kind of told the mom. The mom said that the father was actually like, I'm done after this. Like, we're not going to keep trying. We're like, we just need to accept that this is a lifelong, like medicine says it's lifelong. Your child has autism. I'm sorry. There's really very little that can be done. They're going to have autism for the rest of their life. That is so untrue. And it's so ridiculous that there's so many published research articles on various different therapies that are shown to improve the core symptoms of autism, yet there is zero pharmaceuticals that are shown to improve the core symptoms of autism. And so when you do research, though, you got to understand that I'm not chasing symptoms, I'm chasing the core issue, which is the neural development and the maturity of the brain, and the appropriate wiring and firing in the brain. We're not chasing symptoms, we're improving brain function, and then ultimately symptoms go away because it's the dysregulation and dysfunction within the brain that drives those symptoms. But the dad was like, I'm done.
Yeah.
Mom got him to say, okay, to 1 week intensive at this clinic. Went to that week intensive, 2 hours a day, 5 days a week. At the end of it, he's speaking full sentences to mom and grandma on the drive home. The father was so blown away, he paid for 3 more weeks of intensive after that. Like, was just like, and that was a testimony that, like, this wasn't just, the dad was so doubtful that he's like, I'm done after this. If I will appease the mother, do it. But if it doesn't change anything, we're not doing anymore. And then they've gone back. And so that was a
That's
testimony.
awesome. Well, I know right now people are going like, I need to get this guy's phone number right now. So go ahead and give that right now before we get any further.
931-591-2010 is the office phone number.
One more time.
931-591-2010, and that is Wild Roots Wellness.
All right. Well, so much great information already. And but I do need to remind you guys that school is right around the corner, guys. And I know that many of you are needing haircuts and your kids are. And so I want to tell you that DK Styles is awesome for this. And you know what? They are open today, 9 to 7. And tomorrow, 8 to 3. So you can still give them a call and get an appointment to get that new school season haircut, okay? Their phone number is 615-384-8999. Again, that's 615-384-8999. Make sure you tell them Lee Marie sent you. You know, they're easy to find. They're right there on Tom Austin, and they do everything, you know, styling, color, perms, waxing, tans, and for all ages. And they just do a great job. That's where I go, and I always see lots of kids coming in for school time. So, guys, make sure you get that appointment scheduled today. Matter of fact, they open at 9 o'clock, so that's only about 20 minutes from now. Okay, another thing that you probably want to make sure that you are taking care of is your mower. We are just like in the thick of mowing season right now. So make sure your mower is working great. If it's not, you can certainly go to Ridgetop Mower of Springfield. Gary Rastelli is an expert. He's been in this field for so long. And I know I had stopped by and he said, see these blades right here? This person had taken their blades to I'm not going to say what the store it was, but anyway, took it to a local store to sharpen them. And he said, this is like a teenager's job. This is not. These blades look dreadful. So you want to go to someone who knows what they're doing. And Gary is one of those guys. And he is really local here, guys. He's right between the barbecue place and Ace Hardware. There's a little street called Matthews, and that is where he is at. So let's see, their hours Monday through Friday, 8 a.m. to 5 p.m., and Saturday, 8 a.m. to noon. They're located at 1100 Matthews Street. So for all your mowing needs, they do offer a pickup and delivery service. And also for free, they will pick up your unwanted equipment. You all have some of that. You're just waiting for it to get rusty enough to, say like, okay, we can throw it away now. Well, why wait till it's completely dreadful? Why not have Gary pick it up today or tomorrow and get that taken care of? Okay, also just a reminder, UPS has some really great coupons right now. And again, getting ready for the school season. So right now, their special, let's see, all printing and laminating services for all teachers, 10% off. Also, they have 10% off for business cards, postcards, and invitations. You know where UPS is. It is right there on Memorial Boulevard, that pretty blue awning in the same parking lot pretty much as HG Hill. So they're your one-stop shop. So go on in. of course, you want to say hi to Deborah. Give her a big hug. They're located at 513 Memorial Boulevard in Springfield. If you need their number, it's 615-384-0093. But I know most print jobs, you just go on in and make sure you tell them Lee Marie sent you. All right, those are three of our sponsors. Thank you, sponsors, so much. We only have about 18 minutes left, but we are visiting with Wild Doc, and we do this every first Friday of the month. We're so blessed by everything that he's been doing. It's just been, I really want to have you in Springfield for a conference.
Yeah.
Cancer, autism, so many of those things that people are so hopeless on, and they don't need to be. And I like how you explained why you do need to get rid of the inflammation. Like that analogy with the house burning down is so good, because I constantly keep seeing people just treating symptoms and not going after what is causing it.
Yeah.
Matter of fact, here's a question that is just random. What is this throat stretching that I've been hearing some people they've been coughing, and so oh, you need to get your throat stretched. That to me totally sounds like something that is, again, going after a symptom and not what is causing this cough. What is with that? I've heard now of 2 people getting throat stretched.
Really?
Yes.
I need to know more details about
Okay.
what's going on with the individual to really probably give. I know that I've heard of the procedure for throat stretching and things like that. A lot of times the reason that is coming about because they're having an inflammatory response within their throat, and that can be driven through multiple various different mechanisms. Sometimes that's actually a posture related deviation that actually causes dysfunction because of the throat being on the front side of the cervical spine, that when the neck is out of alignment, it can actually cause constriction or crinkling or wrinkling. It's like try and straighten out a banana. What's going to happen? It's supposed to be curved. So that throat is supposed to fall on the front side of the cervical spine that is shaped like a banana. And so if you put a banana on the front side of a curved, spine, and then you curve it the other way, it's going to squish the banana. It's going to crink, it's like kink it in essence.
Okay.
So there's various different mechanisms that can cause swallowing issues, that can cause irritation in the throat. If it's coughing, I'm guessing it's some sort of inflammatory irritant type response there. There is no evidence that it's because somehow the shrinking occurred because of something. So the idea that you need to stretch it, you're not identifying, you're not correcting. That's the most ridiculous treatment I've ever heard in terms of oh yeah, let's put a balloon in there, let's stretch your throat out.
Right. So we have
well, what caused it? Well, we don't know. It's just narrow.
Yeah.
Well, why is it narrow? It's like what?
Now, a question had come in about bunions, and I don't know if you've ever done
bunions
that.
are just easy. I mean, one, start with your kids. Don't wear closed-toed shoes that squish their toes together.
Okay.
We went even to the point of buying soccer shoes that, my kid gets a little bit of jokes made at him, thrown his way because the toe box is super wide. And so it gives his toes plenty of room to splay out. But it's like, why do women get bunions way more than men? What kind of shoes do women think look good? Those pointy-toed, heeled shoes, things like that.
So that's what's causing it. Okay.
Designer shoes. That's a major cause of bunions. So it's like just, look at these Earth Runners,
Okay.
That's what I wear to the office, from the office. I go barefoot in the office.
So if they already are getting the bunions, if they stop wearing those, does it help to?
Now you've had a structural deviation of the toe. You've got this callus, this calcification occurring on the outside of that big toe. And so it can happen on the small toe too, the pinky toe, but it's that deviation of that joint. So you can get those little spacers for your toes for one thing to start trying to help. We can put red light laser therapy on there that improves tissue remodeling and healing. You get on an anti-inflammatory diet that significantly typically will lower the pain even before even doing anything structural to the toes and foot. We can do adjustments to the foot to break up scar tissue and calcification to allow for more mobility of those joints. And through that process, you get better blood flow and circulation. So there's various different things we can do. And so a lot of people that have had bunions and thinking, no, I got to get surgery, I've been able to help prevent surgery with
That
something
is so
simple as that.
awesome. Is there anything you don't know, by the way?
I study how the body works and functions, so it's just like, okay, that this is one of the issues with the healthcare system. Like, I'll take somebody in their diagnosis. So I'll take, for instance, a woman who has who's infertility and extremely painful emergency department IVs during her menstrual cycles. Like, that's repetitively the life she lives. I looked at her CBC with differential, her blood work, the most inexpensive, simple blood work out there that her doctors ran. And I said, do you see here that your neutrophils are extremely high every time, like high 70s, like 78, almost 80 at one point in time? Like, I'm going through them and I'm like, that indicates, when you understand the immune system, that indicates you're in a Th17 immune response. You understand what Th17? What's crazy is medicine, literally like 20 years ago, used to think that Th17 was the same as Th1. And in fact, they're completely different. They use similar cells, but they're trained in a different fashion. Th17 is highly tissue destructive. So it destroys tissue. It is the primary immunological driver of tissue destruction during autoimmune flares and autoimmune disease. And if you can downregulate that Th17 immunological response and profile, you can significantly improve that person's quality of life because you get out of that tissue destructive state. I looked at that and I was like, do you know that Th17, elevated Th17 immunological responses are well established to be a primary driver of the severity of endometriosis? And that's the condition you've been diagnosed with. And then I'm like, also, the problem is a lot of the pain, discomfort, and things like that come from a hypoxic environment. That's a low oxygenated environment due to the inflammation and swelling and things like that of your uterine lining and your uterus and your pelvic floor, pelvic area. And this is why long-term endometriosis ends up in, creating so much adhesion and scar tissue from possibly the uterus to the pelvic floor to the intestinal lining and things like that. You can have adhesions, and then you have bowel problems because now your intestinal tract that's supposed to be able to slide and glide really nice and easy has all of this scar tissue built up against it and adhered to it, so you get even more pain and constipation and all. I'm explaining all of this to her, and she's like, holy cow, now I literally understand my condition better than anybody else. And she's like, I've gone to an OB and no one's ever explained this to me.
Wow.
And I'm like, so they ran your blood work. Did they ever say anything? It's flagged as high. Like, it's outside normal ranges. Did they ever even mention it? And she goes, no. And I go, so wait a minute. Why'd they run blood work then if they're not going to note something that is well documented as being a primary mechanism in the severity of endometriosis and infertility? Like, super high neutrophils on blood tests is an indicator that the immune system is out of balance and driving tissue destructive mechanisms. And that can lead to the rejection of an implanted egg, the egg and sperm.
Wow.
So it's like, it's a primary driver mechanism in your infertility. It's a primary driver mechanism right now in your, and we're literally only about a month and a half into treatment right now. She just had her cycle again, and she's like, cross my fingers, this is so much better.
Wow.
Like, the first one, like, when we met, and then, like, we didn't get to initiate care because she had another cycle. Like, she came to me and she was like, what do I do? Like, I can't even, like, she's crying. She ended up back in the hospital again. I'm like, oh, we got to get you out of this. And she's like begging me, what can we do right now? I'm like, listen, you got to give it time. I know you're in the throes of it right now. I don't have a quick fix. Obviously, pharmaceuticals and sedating you and stuff like that, they don't even have a quick fix for you. I'm like, I can't push the needle that much with the therapies I even have right now. Give us time, and we're going to work on your body's ability to heal. And she's doing so much better even within one cycle.
Wow, that is
like,
so
understand
awesome.
It.
Yeah.
So anyways.
Well, and when we do the ad for this show with you, it says we try to stump the wild doc, and that's true. Like, we try and we can't. But it's great that you just look at everything, and it's frustrating though when you have friends or family members that want to keep chasing after all these different doctors because their insurance takes them. They're driving all over to different counties, and And it's just like, why don't you just go to Wild Doc and get to the bottom of it once and for all, you know? I mean, many, like you said, many of these doctors don't even they don't even know how to read the blood test.
Yeah.
You know, like I know that the Wild Doc equivalent that I had in my former state, you know, he said, you know, we look at the whole blood, you know,
Yeah.
we can tell so much more.
It's funny because I've gone through functional immunology training and functional neurology training, and I've heard in the functional immunology training, professors saying, "Oh, if you want something complex, you think this is complex, you should look at, study what the neurologists study." And then it was funny because after I did functional immunology and then I was going through functional neurology training, the neurologist was like, "Oh, if you want to see something complex, study the immune system. That's way more complex than the nervous system." So it's like they argue about who's more complex, but it's like I've studied both of those. And you can realize the interplay between, and that's what's amazing about where I've come and where God's led me is like, I can sit there. Like yesterday, I just had a sit-down meeting with a mother who's dealing with anxiety and depression, has been dealing with ADHD. All right. I just took her time and I said, "Hey, you entered into the Army National Guard and you had multiple immunological, stimulants, we're calling that. And then your cognitive health, anxiety and depression, and ability to handle stimuli in your environment got way worse." Yep. I'm like, because there's an immunological component to anxiety and depression and mood disorders. In fact, I can show you research that says that there are some in the immunological sphere and community who want to reclassify mental illness as an immunological disorder in a certain subset of patients. Like
Interesting.
a significant subset of patients, it's more of an allergy or an inflammatory, like autoimmune case that's going on. It's not actually a mood disorder. It's just the mood is being thrown off by the immune inflammation. Okay.
Very interesting.
And then she tells me in her story that she has decreased, or she gets cold hands and feet frequently, like poor circulation, pale. And I'm like, so if you're cold hands and feet, that means that your body is either shunting blood away from that area so it can push it to your brain to have sufficient blood flow to your brain, or you don't have enough volume. And again, that's occurring. If you don't have good blood flow to your hands and feet, you don't have good blood flow to your brain. And your brain may be about 2% of your total body weight, total body mass, but it uses more than 20% of your oxygen that your body takes in.
Wow.
So you cannot think well, perform well. Your brain will not function well if you do not have sufficient blood flow. And then when you look at what are called MRI studies, SPECT scans, blood perfusion MRIs, you find that there's decreased blood flow to regions of the brain necessary for controlling mood regulation. And so it's like, you have a blood flow issue to your brain right now. That's what you have. And so she's like, "What can I do?" Well, I was like, "Okay, so we can do this, this, and this." So I just lay out, how do we improve perfusion and blood flow? How do we help rebuild new channels to your brain so that your brain can get sufficiency so that it can work at its optimum?
Wow. Just fascinating. And of course,
being the psychologist, she's just like, "No, this is just here, take an antidepressant anxiety medication." Like that's all they like list the symptoms and they said this, and they didn't take any history. They didn't think about the complexity of the case. You just understand the body, the way it works, and then you can it becomes almost like simple now for me.
Definitely. All right, guys. We're definitely going to have to make this show a 2-hour show at some point.
I don't know if my wife's going to let that happen.
Yeah, probably not. But anyway, I do want to tell you guys, Coldstream Camp, make sure you get signed up for it next year, because this year was amazing over there and their dates filled up so fast. But you can still get some dates in for your little church retreats and different things like that. Go over there, get a tour. They're only about 15 minutes away from this station, actually. They are in Adams. And you can give them a call at 615-696-2208, or you can visit coldstreamchristiancamp.org. They have a lot of different options for retreats, and they have a beautiful lake. You just got to, if you haven't been over there recently, you really need to get over there. Christ-centered summer camps for the youth. And speaking of Christ-centered summer camps for the youth, I got to tell you about this, guys, because this looks absolutely amazing. Tonight from 4 to 9 p.m., and then tomorrow from 9 a.m. to 8 p.m., there is going to be 6 to 12th grade, just a fun youth summer camp. So that is just, I mean, it sounds so awesome. They're going to be doing water games, worship, a bonfire, and meals. So like, you know, you can get a lot done, guys, dropping your kids off for this really great Christ-centered camp that's just looks super fun. This is going to be at Bethlehem Baptist at 3323 Bethlehem Road in Springfield. So again, it starts tonight, 4 to 9. Dinner is provided. And then tomorrow, breakfast, lunch, and dinner provided because it's 9 a.m. to 8 p.m. So any students that are going into 6th to 12th grade, get on over. It's called Ignite. And I have that on my Facebook page, so you can see that. And guys, don't forget that Southside right here in the square, not only are they a pharmacy, but they also now have a lot of crafts and flowers from many local makers and bakers. So get out on over to Southside. They're open Monday through Friday, 8 a.m. to 6 p.m., Saturday, 8 a.m. to 4 p.m. Their website is southsidedrugco.com. Their address is 1000 South Main Street in Springfield. And guys, don't forget, tonight is the Friday night market. So you will see a lot of us right outside our places. I will be outside Crossroads Christian Bookstore and the Well in the Square. Some of my teachers are going to be there. We now have a lot of different classes going on, not only physical with our, and you know, that's another good way to get oxygen and stuff going through your veins, right? Dancing and exercising. Yep. So guys, our fitness classes are only $5 for Cindy's band class. And then of course I do line dance for Fun Fitness and Friends. That's only $10 or 12 classes for $99. We're making lots of new friends. We're getting oxygen pumping throughout our bodies. It's just a great way to take care and stave off a lot of illness, guys. So our fitness classes are on Tuesdays and Thursdays, so you can come by Well in the Square, get a flyer. And then also we are now doing sewing and craft classes. We have a lady named Carla who has, she not only homeschooled all of her children, but some other children as well, and she is fabulous. She did a sewing class last Monday. We went, even my husband took the class. We had a blast. So I hope you guys will sign up for sewing. It is going to be every Monday in August from 10 a.m. to 11:30. Classes are $30 if you're a late bird, but if you're an early bird and you sign up by this Saturday, it's only $20. So total bargain. And we're even going to have one where we're going to make poodle skirts for the upcoming sock hop on August 22nd. So make sure you get signed up for those sewing classes. Carla is also going to do some book arts. So journal making. If you missed that episode of the Go Show, she came and she brought a whole bunch of journals that she made. Some she made out of like a manila envelope using shoe polish and stuff. Mm-hmm. They look so cool. And so I hope that you guys will take advantage of those crafts classes too. Those are going to be 2 to 3:30 on Monday. So Monday's a big fun day over at Well in the Square as far as sewing and crafts. And then of course Tuesdays and Thursdays is the big fitness and dance and fun and friends. But everything has fun and friends over at Well in the Square. Anyways, we've been talking to Wild Doc, and I know that I've introduced you to some new friends because they've been texting me. And I'm so excited that because it's just fun to, that people can now like, oh my gosh, there is hope for this, because there's a lot of people out there that are just.
We can give it to them.
So once again, where are you located?
We're at 755 North Woods and just off exit 11 in Clarksville, Tennessee. The phone number is 931-591-2010.
Excellent. And the hours approximately?
You got to call to get
okay.
Yep.
Okay.
Yeah.
All right.
I mean, Monday through Thursday are primary office hours. We've got adjustment hours in the morning and the evenings. We got midday on Tuesday, things like that. But we do consultations throughout all other hours.
Okay. Yeah. So I know, guys, sometimes my friends have looked at it and they say, well, I can't get in on this.
Don't
but
get hours.
Yeah.
Nope. That is like technician hours. That's me working on the spine and nervous system. And that's the reality. We can do consultations outside of those hours, and we do, like, obviously during those hours is not when I do my functional neurology intensives, things like that.
Yeah. So and
what
when
they
you
have going on and what they need will determine,
Okay. Yeah. And those consultations are amazing because he really does look at the whole history, and that was just so fascinating. From the time that you were born. How were you born? So awesome. You're doing an amazing job in the community. We're so thankful for you. And anything else? We have like 30 seconds.
I'm good.
Okay.
We got enough information, I think, to chew on.
All right. Well, thank you so much for coming in. We'll see you next First Friday.
Good.
All right, guys. Thank you all for tuning in. This has been Lee Marie on the Go Show. And this has been Wild Doc. And he's really not that far, guys. It's Clarksville, but he moved closer to us, for us. And maybe someday he'll even be closer. But that is just a little wish and a prayer that I have. Anyways, guys, I will be back next Wednesday. If you missed last Wednesday's show, guys, you really need to go over it because I went over a ton of things that are happening in Springfield and Robertson County. There's so much going on. It's real exciting times right now. So make sure you listen to that. All right, guys, have a great day. Love you all. You've been listening to 1100 WSGI.